How do you help educate dentists in the community by taking a leadership role?
Locally, I've been involved in providing continuing education for dentists. I'm an accredited continuing education provider, teacher for the Academy of General Dentistry, which is the largest of all dental organizations. I can issue continuing education credits to dentists. And I do so because I run a number of study clubs. One is a study club organization that's part of a larger network that's called the Seattle Study Club, and that's mainly because the person who got it started it in Seattle. And there's almost 300 study clubs across the world now, most in the United States and Canada, that participate in this. And it is by invitation, and it's a rather select group of people who are very dynamic in dentistry and provide services at the highest level possible. This is what they're about. And locally, I have one called Comprehensive Care Study Sessions, my orientation, comprehensive care. And we meet 9 times a year minimum, every month except in the summer. We do have speakers come in. We also have homework projects. We also have case studies where we examine patients, we diagnose them, we plan their treatment, we seminar about that, and we teach each other. One of the activities that my study club provides for its members is what's called treatment planning sessions. What will happen is that a member of the club will document the patient with photographs, with what are called chartings, making all the measurements and identifying the fillings and providing x-rays and providing plaster models and more. And the group will study the patient. And then the group will develop a diagnosis, because to treat well, you've got to have a thorough and accurate diagnosis. And then the group will develop one or more treatment plans. Now, traditionally, dentistry is practiced in a dentist's office. And at the end of the night, the dentist goes out and does whatever they do. In hospitals, as a contrast, doctors have regular routine study meetings and review cases, and they interact. Okay, this is the equivalent of that for dentists. And they get to hear other ways to see and to think about their casework. What most patients don't realize, and I'll just speak of me, is that I can spend an hour or two at my desk developing my diagnosis and 1 or 2 treatment plans, which requires detailing everything. And this is a way for a young practitioner to see that, hey, this isn't done in a split second by the chair. This is done at a desk thinking. And that there's many ways to think through this. And by doing it with your colleagues, you pick up things you never thought of, or hear why they wouldn't do it that way. And it's a great exchange and a great learning experience.